aspirin is a medication that's going to be essential for you to know regardless of what area of the hospital you work or what area of nursing you work. You've most likely come into contact with aspirin at some point in your life, and you understand some of the risks and things associated with it. So generic name is aspirin, trade name is going to be like Bayer or something like that you're going to find just in the over-the-counter medications. But we do get it in the hospital sometimes for various disorders. So indication for use is going to be like rheumatoid arthritis, osteoarthritis, ischemic stroke, MI prophylaxis. So you can see it's dealing with these inflammatory disorders, these ischemic disorders, as well as we can give it for fever reduction as well. Its action is what it does is it really inhibits the production of prostaglandins. And what these prostaglandins do in our body is they actually lead to fever and they lead to inflammation. So if we can inhibit the production of these prostaglandins, that gives us the ability to reduce the fever and decrease the inflammation. Okay, another thing that it does is it decreases platelet aggregation. Okay, so it stops these platelets from aggregating, from combining together and clotting. Okay, and this leads to a decrease in ischemic diseases. So for example, like we said with ischemic stroke, if we have an ischemic stroke, a lot of times after the stroke and in the recovery period, we'll put the patient on aspirin to decrease the risk of that platelet aggregation. And then we also give it with like MI prophylaxis. So a lot of times you'll see elderly adults taking like a baby aspirin or something like that. The purpose for that is to reduce that risk of them having a heart attack. Okay, so that does prevent, or that does create some risks because these patients are thinning their blood out a little bit. And what can happen is that if this patient were to fall, these elderly patients, if they fall, then they're at a much higher risk of bleeding, okay? So therapeutic class is antipyretic and non-opioid analgesic. Its pharmacologic class is salicylate, okay? So here are some nursing considerations that you really need to keep in mind. The first one I want to talk about, and we're going to talk about really briefly, but it's important to know, and it's important to teach to all your friends who know you're a nurse and everything like that, is that aspirin can lead to Reye syndrome most often in young children, in infants that are recovering from a viral infection. So upper respiratory infection, chickenpox, things like that. And so a lot of times in the fall, we have these parents who their baby has a fever, so they start throwing aspirin at them, or their baby's fussy, they start throwing aspirin at them. The risk with that is that there is a connection between aspirin use in young children and Reye syndrome. And what Reye syndrome is, it's a life-threatening disorder that can affect the brain and the liver. Okay, and in the worst cases, it can lead to death within hours. Okay, so if the baby becomes more somnolent, vomiting, things like that, that could be indication of Reye syndrome. They need to rush them to the ED immediately. Okay, so there is an association between Reye syndrome and aspirin use, especially in patients that are overcoming a viral infection, things like upper respiratory infection, chickenpox, and things like that. So you also want to use, like we said, caution with bleeding disorders. So if the patient has thrombocytopenia, low platelets or something like that, or hemorrhagic stroke, anything like that, you'd want to really use caution with this, or chronic alcohol use, as this is going to affect the liver. This can also lead to Stevens-Johnson syndrome, which is kind of that skin disorder where we start seeing the skin sloughing off of the body actually, and so that can actually lead to that. So we'd want to watch for any sort of rashes or anything like that. Can lead to laryngeal edema and anaphylaxis. Like we said, again, I really want to stress this, is that it increases the risk for bleeding with warfarin, heparin, and clopidogrel. Okay, so we really want to be very closely monitoring our patient for any signs of bleeding, petechiae, any sort of spots on the stomach, bleeding in the sclera, things like that would indicate that the patient may be bleeding. We're going to be new bruising, anything like that. Increased risk for GI bleeding with NSAID use. So NSAIDs already lead to the risk for GI bleeding, but if we throw aspirin on top of an NSAID, then we have an increased risk for that bleeding. And then also alcohol use with aspirin can increase the risk for GI bleeding. So big things to keep in mind here are Reye syndrome, bleeding, and those are really what you're going to keep in mind. This has been another episode of the Nursing.com MedMaster podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.